Official. Welcome to your Medicare journey. Now, what is Pluto doing this for? And why did they pick me? Number one, I'm 65 years old. So guess what? Like a lot of you, I'm actually more of a rookie to Medicare. So this is going to be very helpful to me. Secondly, my wife and I have been married 43 years. She's only 35. Keep that in mind, guys. That's how you do the math. But uh, she's like on her second year of Medicare, and we already switched plans once because we realized the first time we did it, we didn't do our homework very well. So that's a big deal. We want to help you to be able to do things, in sports, for that analogy. When the Browns play the Bengals this week, hopefully they're looking at scouting reports and game films of the Bengals. We need to do that when we're looking at Medicare. And then we also have somebody to help us maybe with Medicaid, which I've done for a couple of people too, to help them get Medicaid. And boy, that's a tough process. So we're here, and I'm just really grateful that a lot of you have turned in. I know a number of you are watching, have heard me speak before and that. So, okay, I'm a little nervous. I'm not so good on the Medicare, Medicaid stuff, but we brought in experts and they're going to help us through all of that. So in terms of here's what we're doing. I was waiting for them to pop that up on the screen. We're going to be real smooth here as we go along. Number one, what's new in 2021, the open enrollment plan? Because I've learned that already for a couple of years in Medicare. They keep changing stuff. I bet some of you have had that. Well, I thought it was this way. Well, now it's that way. Number two, huge thing, do you have the right plan for your needs? For example, my wife has serious allergies, and there's certain doctors that she can see and others, and you got to make sure that all comes together. Finally, choosing your drug plan. Like it or not, most of us are going to end up getting prescriptions, and we're going to need help with that because all drug plans, all Medicare plans, all of this stuff, it's not all created equal. So that's our agenda. That's what we're going to go through, and hopefully we're going to do it in a really clear manner and have some fun with it along the way. Here it is, the Q&A box. We need to hear from you, and I'm very serious about that. It's just like when I speak in libraries, many of you maybe have seen me. It's like, I need a question. We need a question today just to get it going because we need to know what you're thinking, and a lot of questions will probably pop up. So you need to do that. You open the Q&A on the bottom of your screen. It allows you to ask questions. You'll see there's a nice little box. You just type them right in there. I may be seeing some. There are going to be some people helping me with the questions. I could use all the help I can get on this stuff. But really, you're the one out there, and I wanted to say, we got to take it seriously. We got to get this stuff right. As I mentioned once already, and I'm going back to again, already my wife, we had to switch Medicare plans with her once already because our first choice wasn't the best. So we want to make sure we make the right choice, the right time, the first time. Okay, here's our sponsors. We want to thank Medical Mutual for this. They're supplying some experts. The Plain Dealer, my employer, please keep buying the paper. Cleveland.com, read me online, read me often. Hey, you can click on my stories 50 times a day. The more times you do that, the better it is for me. And then finally, I'm going to say something that's just totally off script. I've been working in this market now. It feels like 100 years at times, but really, it's since 1980. And I've been so blessed to work in Northeast Ohio, whether it's for the Plain Dealer or the Akron Beacon Journal during all that time, and to be writing sports for the teams and places that I grew up with. I went to Cleveland Benedictine, Cleveland State. So I'm grateful to my sponsor, who also is my employer, the Plain Dealer, cleveland.com, and to Medical Mutual for bringing this all to you. All right, so what's new in your enrollment plan? I mean, that's going to be a big deal. So we're going to find out as we talk to different people on, do you have the right plan? I'm going to keep going back to that over and over again because the temptation is I have this plan and I'll just stay with it because I've had it before. I mean, do you have the right plan? And sometimes we need to really ask ourselves, what are the most important things? So we're going to do that. What's new? Because again, they have changed things, and that's why I need some help with that for some questions and things from people. So that's what we're up to. Yes, here it is. The Plain Dealer put out a Medicare section over the weekend. I looked through it, I read some of the stories. A big thing that could help some people right in the middle of that section was a big graphic on all the different plans, what they offer, what works, what doesn't. You could find some of this stuff still online, but sometimes when you hold that paper and you look at all those plans, it's just like I keep getting all this stuff in the mail from these different Medicare plans, and they even call the house. I don't know how they got the number. Your head could feel like it's going to explode. So what we want to do today is kind of simplify, level that out, so that not only are you picking the right thing, you feel pretty good about what you're doing. And there's a cliche, let's cut out all the noise. So we're going to cut out some of the extra noise and try to, one of my favorite lines is from Stephen Covey: make the main thing be the main thing. And let's do that for you. So, all right, we'll go right back to the initial question, right back to, do you have the right plan? And then we're going to start getting discussions. All right, here's our panel of experts. And by the way, this is like having a good offensive line in front of me, because I'm going to need help. We have Dr. Terry Koenig from Chief Medical Officer of Medical Mutual of Ohio. And we have Teresa Foster, who goes by the name of Terry, but she's going Teresa. Then we have too many Terrys because we have all these Terrys here. So anyway, but she is a director of Aging and Disability Resource Center at Western Reserve. And by the way, this is a big, they both bring different forms of expertise, and they both are very important, because among one of the things that Terry Foster does is long-term care. And I have helped some people with that along the way already. So that's where we're at. We've got our experts going. Dr. Koenig, I'm going to start with you. What would be, somebody say, give me 3 things I got to know about Medicare. What would they be?
Well, you have to look at what type of Medicare. There's a couple major types of Medicare out there. We all think of Medicare, of the traditional Medicare. That actually includes a Part A, and you get that when you turn 65 and you've been paying into your taxes. That takes care of your hospital piece. That part of Part A, if you go into a hospital, you have to pay anywhere between $1,400 and $1,500. Then there's Part B. That's your outpatient part. And that's your doctors and your testing. And Teresa and I laugh about all these letters, right? It's like Barney alphabet soup. So Part B is your outpatient. And then there's the Part D. Medicare Advantage on the other side packages everything. You can get your Part A, your Part B, they combine it and call it C, and your Part D. So
Doctor, really, a second, and yes, this is what I found too when we started looking at it, because my wife's a couple of years older, is that the assumption, oh, I'm on Medicare, I'm golden, I'm all set. And then all of a sudden, here came all the letters, as you said, and all the stuff. And of course, some places, A, B, C, and D is not enough. They want to go E, F, and G. They may not have that, but it could just go around and around. So what we want to do is...
Well, you're absolutely right, Terry, because if you get the traditional Medicare, it's an 80-20 plan.
Yeah.
You will always pay 20% on Part B. So you can then buy a supplement plan, as you mentioned, the rest of the alphabet. But that's why Medicare Advantage is becoming the fastest growing aspect of Medicare in our country. And I think in Ohio, we have about 34% of Medicare eligible in it. It's one stop. Now, that's not without things you have to be aware of. Is your doctor in the network?
Yeah.
What's your out of pocket? But a lot of these plans have 0 copays, 0 premium, and a maximum out of pocket. So it's the ease of combining it all. When I talk to patients, I would always say, you have your doctor, your drugs, and your finances. And those are 3 big areas you need to look at when you make your decision.
And then Teresa, too, on this, along those lines, another thing I was a little surprised, I thought, well, long-term care or something like that, isn't that all kind of wrapped into the basic Medicare? And what's the answer to that one?
The answer is a big fat no. Medicare does not cover long-term care services. I think where folks might get confused is because Medicare will cover skilled nursing facility care. So you have an acute situation, you go into the hospital, you have to have your qualifying 3 nights, and then Medicare will pay for you to go to a skilled nursing facility for rehabilitative services. Long-term care doesn't come into that equation at all.
And then
Completely
also,
separate.
I remember this, Teresa, is that with a friend of mine that I was helping, it's kind of a sliding scale depending upon how long you're in nursing care, because it had to do with a hip replacement somebody had, and then that didn't go so well. And so that's why we really need to be real clear on this. Dr. Koenig, what else, say on the first time I'm looking at this and I'm feeling overwhelmed, what would be one or two things you suggest I should do?
Get help. Listen to experts, have your family help you, listen to webinars like this, reach out to Teresa's agency. If you do have an insurance broker you trust, it is complex because there's enough opportunity out there that you can get the plan that's best for you. Again, you want your doctors. You mentioned your wife. You would make sure her allergist was in that network. We're going to talk about drugs. Drugs, we all are going to be on drugs as we age. Some of us are on them when we don't age. What are those costs on that plan? What are your drug copays? You can get mail order drugs in the Medicare Advantage. And that's where Medicare Advantage, when I've worked with patients or groups, becomes a little less daunting because you don't have to worry about you're in the hospital, you have that copay, you have the Part B copays. As Teresa mentioned, the SNF, that's all included in one. But you have to find what
here's
works
a question
for you.
along those lines, Dr. Koenig. It says, and this is a real basic one. This is what we need. By the way, sometimes I write scribbles in my notebook. There's a notebook page. Here's some scribbles. So here we are. After you sign up for the original Medicare, how long do you have to wait to sign up for the Advantage plans? First of all, what is our time frame for Medicare, signing up for it?
You can sign up for Medicare. Teresa, correct me, but it's 3 months before you turn 65. You can sign up for it.
Okay, and then right now, in terms of the re-enrollment period, I think, isn't it October 15th to Pearl Harbor Day? I think December 7th.
December 7th is called the annual enrollment period, is where enrollees can choose to go into a Medicare Advantage plan.
All right, is there a difference on, okay, I have the regular Medicare, but is there a different time frame for these Advantage plans, or does that all fall in that same time frame?
The annual enrollment period, you mentioned the October 15th and December 7th, is the annual election period for the Medicare Advantage plans.
Okay, here's a good one that I like this because this is actually a discussion my wife and I had a while ago. So it's from Pamela. She says, I'm on my husband's insurance through work and will probably be that way for 10 more years, but I'm turning 65 in September. What do I do? So what would her options be? Either one, Teresa, would you know on that?
Sure, she has options. Now she can stay on her husband's insurance. That was the question, right? She's on her spouse's insurance? Okay. Yeah. She can stay on her spouse's insurance and not join Medicare at all until they need it. However, they generally recommend that you speak to your employer, the HR department, to see how Medicare would work with your, personal private coverage. I can give you an example, say, of my mother-in-law who did not retire at 65. She went to her employer and they asked her to sign up for Medicare, and in exchange, they paid her Medicare premiums. Oh. So there is no penalty if you don't sign up when you are eligible, provided you have employer coverage. You have up to 8 months after that employment ends to then sign up without incurring a penalty. But if you don't sign up when open enrollment, when you're 65, it's 3 months before, the month of, and 3 months after without incurring penalty. But if you have coverage, you can sign up at any time up to 8 months afterwards.
And the one thing I noticed, at least when it came in my situation, when my wife Roberta turned 65, which was about a year and a half ago, and she was on our plan, and I'm 2 years younger, so we ended up putting her on Medicare. It was just a better deal, and I have a feeling in most cases. All right, Dr. Koenig, generally Medicare is probably better. Is that fair to say than most company plans?
I really, you can't say that. Every plan has to be evaluated.
Okay.
I mean, traditional Medicare, again, you said it earlier, Terry, we all think, oh, great, we're golden.
Right.
It's very expensive at the end of the day, especially if you have health issues. As Teresa mentioned, and you mentioned, you get so many days in a SNF and then you have a daily charge.
Yeah.
Every time you go in the hospital, if you're in the hospital for a long period of time, you get daily charges. So unfortunately, people have this idea that it's this great coverage, and it is in some cases, but employer coverage depends on what type you have to compare it against. And Teresa gave the best advice to check with your employer.
Yeah, and it also depends on how many employees that employer has. As someone mentioned, that's true.
I see it on another screen. This came from Mary, and she said, I'm turned 65 in May. I still have insurance coverage through my husband's employer. It's kind of along those same lines. Do I have to enroll now? And here's her big question. Are there penalties for not enrolling when you're first eligible?
No, there aren't, as long as you can prove that you were covered at the time when you were 65.
Okay, so she's got time after that to
Yes, she has up until 8 months after employment ends.
Oh, after employment ends. Okay. And then somebody, Fred sent in a thing, says, I'm in a high deductible insurance plan at work. And do I need to register for Medicare? These are, I guess, that's the problem with all these things. You have to keep trying to figure out what you got, what you don't have. Dr. Koenig, what would you say is like one big mistake people make when it comes to this thing?
Not looking if their physicians that they want to see are in the network, not understanding if they're in a tight, narrow network like an HMO, where they can't go out of that network versus a PPO, and not making sure.
What's an EPO?
There's an HMO, which is a health maintenance organization, usually a little smaller. And then a PPO is a preferred provider organization, has a little more coverage, and some of those allow you to go outside for a higher cost. So again, it's your doctor, where you need to go, are the drugs you are on in there, and what is your maximum out-of-pocket expense?
Another thought on this that I learned, and we learned this, and fortunately somebody tipped us off on that, was we were looking at one plan for my wife and had to do with that allergist, and basically the plan kind of said he was in it, but we did call the office, and it turned out that they were in the middle of not covering there and going to somewhere else. So that's one thing just from personal experience I'd recommend, especially if you have sort of some special physicians you really want, just because the book says so. Don't be afraid to make a call and double check on that, because that could really be a problem. Terry, what about from your end? What's a big mistake people make?
Well, I would piggyback on what Dr. Koenig said. Also, not doing their homework and looking to see. One of the things that I mentioned last week was people who are snowbirds. So if you spend the winter in Florida, or you spend the winter in Arizona, or wherever it might be, if you choose an Advantage plan, you have to be careful, because that Advantage plan, let's remember, is regional. In Cuyahoga County alone, there are 93 plans this year to choose from. So, and that's making the assumption you're regional and you're going to stay regional. So if you go to Florida for 3 or 6 months out of the year, is that plan going to cover you out of state? How much more are they going to charge you because you're out of network? So I think sometimes people say, I'm going to choose this Advantage plan because it's cheaper and it's less work for me. It's all inclusive. But then on the flip side, oh, wait, I spend this much time out of state and now I'm paying more.
And the good thing here, by the way, this is good because I'm seeing some stuff in the chat that helps us too. Someone wrote in, and I think this is correct. If you are under 20 employees, you must sign up for Medicare. You know, again, those are those rules that change. Is that true? Does anybody know?
I believe that is true, and that's because if you have less than 20 employees, Medicare is the first payer.
Okay.
Whereas if you have more than 20 employees, your private insurance is the first payer.
And I guess some of the people are asking, okay, they never did sign up for Medicare, but now they're 67. It's their first shot at it. What about that?
Well, you want to enroll now, right now,
Yeah.
but be prepared for a penalty, and that is 10% per year.
Wow. So this gets to be more serious business the longer you go along. So,
Yes.
you know, just kind of looking at some of those things too, is like some people talking about, you know, a lot of people have diabetes and that. There's certain type of plans for that you really want to look at. Dr. Koenig, any thoughts?
Well, you really, again, if you're seeing a specialist, is your insulin covered? And then the other aspect of the Medicare Advantage plans, again, is that they are required to help you manage your chronic condition. The government monitors the plan as well as the doctors and the members. So those plans may have additional benefits, home monitors at a different level, no copays, care management programs to help you stay in control, transportation to your doctor, over-the-counter drugs, many other aspects that may help you manage that diabetes.
One of the things that I found was sort of I didn't know this until we had just signed up for this one plan, is that we are able to get some vitamins and that kind of stuff, health stuff for free. This plan was had through Walmart through certain brands. Is that common? Do you know? Because I'm always very interested in the natural product stuff.
Yes, I think that's, as Teresa mentioned, you really have to do your homework.
Yeah.
93 plans is overwhelming. But if you look, many of them, if not all of them, will have some type of supplemental benefits. And that's where, Terry, you're over the counter, whether it's Tylenol or herbals, transportation, eyeglasses, hearing aids. They should all be listed out on the Medicare.gov, or then again, get help from your family, get help from brokers, get help from great agencies like Teresa's. Pick up the phone, call the plan, hold their feet to the fire, right? Get your answers. That's why I think something like this, especially in the COVID world, is so important. This is a big decision. You have to make what's right for you and your family.
Yes.
And I guess my other thought would be, like I mentioned with my wife, we picked one plan. It turned out wasn't particularly, there's no one size fits all, I guess is where I'm going with this. And don't be afraid to change. Is that fair?
Absolutely.
That's fair.
Yeah, go ahead, Teresa.
Yeah, I was just going to say, you hit on it. It is so individual. I was sort of fearing this podcast in a way because I was fearing individuals would be sitting at their computers thinking, okay, after Teresa's done talking, I'm going to know exactly what I'm going to do.
Yeah.
I'm going to know what plan. And really what I'm hoping to do is create a framework to help you understand how individual it is, to look at what's important to you, to sit down and plan on spending some time. This is not a quick in and out kind of thing. And it's as individual as choosing a provider.
Kyle wanted to know I guess he heard the mention of the penalty. If the penalty is 10%, what does that mean?
It's 10% of the Part B premium. So for example, this year, the Part B premium for most people is $144. So 10% would be $14.
So in other words, instead of paying 144, you pay like 158?
That's correct.
Okay, so that's,
And
Benedict taught me math. How about that?
Yeah, Teresa, there's also a penalty on Med Sup at some point. I think that's just something people should look into.
Yeah, and there's a penalty for D as well, and it's 1%.
Right, if you don't sign up when you're supposed to. So people need to understand that.
Yes.
Fully.
All right, and Kathy, can you get back to the original Medicare if you've been on the Advantage Plus, the Advantage plan? Can you just go back to the original Medicare? Anybody know the answer to that one?
Yes, yes, you can. So if you initially go when you sign up and you Advantage plan initially, within 3 months you can convert to traditional no questions asked, no problems. If you don't do it within the first 3 months, then you're stuck in that plan for a year.
By
Now,
the
what I
way,
do
go ahead, Teresa.
Now, what I do want to point out is if you start off in traditional Medicare, you then change to Advantage plan, and then you say, oh, you know what? I don't want this Advantage plan. And now I'm going back to traditional Medicare. You have to be careful because you may not be able to then purchase your Medigap, your supplement policy.
Oh, boy.
And you can be underwritten, and in order to then get one, you may be charged significantly more.
Another there says, can you address Part D Medicare when a person has insurance from their work and they're signing up for Medicare? So I guess that goes back to the question about if I got regular insurance and they go on. Basically, if you have regular insurance, you go on Medicare, then you're on Medicare, you're not on the regular insurance for the company. Is that correct?
You'll be on both oftentimes because they'll pay the difference.
Okay.
Again, that's one where you really should work with your employer to understand the size, the coordination. Employers really can't incent you to leave their plan to sign up for Medicare legally. So there are some, if you're working, talk to your HR, they're well versed in this.
Yes.
So I guess the other thing that we need to really look at is when, you're on this plan and all of a sudden, say you didn't have diabetes or something like that before, and now suddenly you developed a new problem. The assumption that your current plan is the best thing when you're diabetic or having something else, probably could be a dangerous road if you're not sure. Help me on this.
Well, let's talk about that. If you're looking at, nobody expects to have an illness, but we do know in our country as we age, higher percentage of us have chronic diseases. Again, if your doctors are in your network and you know your maximum financial exposure and it has a good formulary, you should be pretty safe with the Medicare Advantage plan, because that maximum out of pocket is going to protect you.
Right.
If you have 5 hospitalizations or none, you're only going to use that if you have healthcare needs. Where the benefit from Medicare Advantage comes is the wellness initiatives as well.
Yes.
They will want you to get your screenings. They will send them to you at times.
Yeah.
They will want you to see your doctor. So, because they want to keep you healthy.
I mean, one of the good things I discovered, is a little off there, but wanting to keep you healthy, is I know that one of the plans that my wife is with, they allowed the health club where we work out, the Silver Sneakers plan, where we used to pay, a fair amount for her to work out there. Well, now it's free. So I think that's something else to check out, and that could save you some cash if you hook it up the right way.
Absolutely. That's why those additional supplemental benefits really need to be looked at.
I guess, I'm getting a lot of, what factors do I need to understand if I have the right need? Where do you think most of the confusion, let's try it that way, when people are first looking at these plans, even if they've had one for a while, where does the confusion come in?
So I think the confusion comes in because there's so much choice. It's kind of like when you sit down at one of those restaurants and they've got 5 pages to choose from. There's a lot to choose from and a lot to go through. And I know that folks can be overwhelmed. I would say you want to start with a lot of what Dr. Koenig says. Your finances are really important. Sometimes they're more important than choice. So an Advantage plan may be the best route to go. Some people might say, well, I don't even take medications. What do I need to sign up for a Part D for? Well, in that case, you probably want to just pick one that's the lowest cost, but get into that plan now so you're not paying penalties and higher rates down the road. It's going to depend on your lifestyle. Do I stay local or do I travel a lot? That is going to factor into your decisions.
I mean, an interesting question here is, said, are you saying, this is from Janet, you don't need supplemental insurance if you already have Medicare Advantage?
That's
I'm not
correct.
quite-
Correct,
And it helped
That's
me.
correct. Right.
correct.
Because the supplement or the Medigap, what they're officially called, is going to help pay that 20% that Medicare
Okay.
does not.
Okay, so, you know, so there's a lot of things that to look at here. When you look at this over the years, you know, how this thing has evolved into such a big industry, a couple people have asked, how do you know who is a good broker, insurance broker, and how do you find them? Thoughts?
Yeah, that I can't comment on. I wish I could. I guess maybe, I don't know.
I would make sure the broker is licensed. They
Okay.
have to have specific training for Medicare.
Mm-hmm.
They have to have a good understanding of the various plans. So there are ways to check out their credentials as well, similar to how you buy other insurance.
Mm-hmm. And the other thought too, in terms of, you know, signing up and that is, actually, it's a real easy question, I think. I'm on Plan B of Medicare. What must I do to get on Plan A?
Well,
Aren't you on it? I don't know.
Well, Plan A, not necessarily. Plan
Okay.
A you have to have worked so long and paid into the government to receive Plan A. I have come across people in my career who did not have A, but had B.
Okay.
Veterans sometimes, some other unique situations.
Yeah, I see here is a question from Margaret said, doctors in networks individually, or are they in the network individually, or are they like just Cleveland Clinic doctors or UH doctors? How does this work?
Most of the large systems that employ large physician groups. So the Cleveland Clinic Foundation has their physician group, universities, Metro.
Mhm.
If they are in as the group, all their physicians would be in.
And Teresa, to
Independent,
go back to you on something I really want to like if a person needs help getting Medicaid, what should they do?
Medicaid with a D,
Yes.
you said. Okay.
Yes, Medicaid.
So you would want to apply with your local county Department of Job and Family Services, Cuyahoga Lake. You can apply online. They've made it super easy now. You can submit all of your information. You can actually upload documents because they are going to require you to go through a determination to prove where your finances sit. You can apply in person at satellite offices throughout your county, or you could even give us a call and we will send you an application and help walk you through it.
Right, so that would be the big thing to do with the Job and Family Services. I know is key on that. So,
Yeah.
well, we're
Job and
wrapping this up, ladies. 10 seconds. Do you want to say anything to our people here, Dr. Koenig?
make sure you get a plan that meets your needs and is a long-term fit for you, for what you and your spouse or family need for coverage.
And Teresa?
And if you don't like your plan, don't worry about it. You will have an opportunity to switch to another plan that best fits your needs every single year.
I think that's a great, both of them, but that's especially a great point. That so if you didn't do it, like I said, we've already switched once. If you didn't do it once, you get another shot at it. It's not the end of the world.
That's right.
And fortunately, all these plans now, pre-existing conditions should be okay, correct?
Yep.
So
Absolutely.
that's a really good thing too. Well, Dr. Koenig from Medical Mutual and Teresa Foster, I want to thank you both.
You're welcome.
And boy, we got a lot of questions, so let's keep them coming because we've got other stuff coming like prescription drug plans And folks out there, you got to help me with this stuff, because as you could tell, sometimes I feel like Baker Mayfield. I just cannot find an open receiver anywhere, and I'm worried about interceptions. So thank you so much for the first part, and we got more to come. And we want to thank you also to Medical Mutual, the Plain Dealer, and cleveland.com for bringing you this webinar. And hey, it's a big deal, because there's a lot of us. Let's put it this way: if you're not 65, pretty soon you're going to get there. At least that should be the goal. And then those of us who are 65, we got to figure this stuff out.
It's your time to relax, to laugh out loud, to do the things you want to do without worrying about your health coverage. That's why we provide Ohioans like you with high-quality Medicare Advantage plans, so you can enjoy life's best moments. We are here for you today and every day. Medical Mutual, the official health insurer of everything you love.
All right. As I said, there's so many different aspects to this. You talk about, first of all, paying for the hospital, then nursing homes. SNF is, by the way, the nursing home thing, skilled nursing facilities. Your regular doctor. If you go to a doctor, you got something wrong, you know what he's going to do? He's going to write a prescription. That means prescription drug plans. And this, again, is a key part of going to a place that you feel comfortable, and that you can make sure that, I don't know about you, well, we got this generic, we have this, we have that. So hopefully, and our plan here is we're going to bring some clarity to that situation. And, we have Jason Briscoe. He is the Director of Pharmacy Operations for Discount Drug Mart right here in Cleveland. And I know Jason right away was asking me who's going to win between the Browns and the Bengals. So we could deal with that later. By the way, better be the Browns. I don't want to deal with the fallout from that. But I also want to know with Jason, how do we do this drug stuff? And how do we get it right? And boy, oh boy, sometimes we get overwhelmed with so many prescriptions or where to go. So we're going to go to Jason right now and chat with him. All right, Jason. One thing that I just wondered, when you were listening to the warm-up, the first half of this game with Dr. Koenig and Teresa Foster, what were you thinking while listening to it?
Honestly, you guys did a really nice job covering a whole lot of ground. But this is a topic that often has more questions than there are answers, especially in this type of format. But I think both Dr. Koenig and Teresa did a nice job pointing back to the individuality of this decision and the importance of not necessarily resting on your laurels from one year to the next, because there are several advantages to take advantage of this annual enrollment period, because you might be in the right plan, but at the same time, maybe there's a new plan that's come to market, and it's just worth your time to check those boxes to see that you are indeed in the right plan, or if another would be a better fit.
Hey, Jason, suppose I get an idea and I want to go with Medical Mutual, say, for example. So since they're the sponsor, I want to go down there. Can I take like their outline of their drug plan, take it down to Discount Drug Mart or somewhere and say, this is what they have, this is what they're offering for their drug plan. These are the prescriptions that I need. How does this match up? Will a pharmacist or somebody help you in that place to do that?
Yeah, so that's a great example. And that individual wouldn't have to bring with them Medical Mutual's formulary in that example. Basically, they can come in whether they're a Discount Drug Mart patient or not, so long as they know the list of medications that they're taking. Just work with our pharmacist, and essentially we have visibility. We have a technology partner that we deal with that essentially has visibility to the next year, so 2021 plan year. So we can tell you what your out-of-pocket would be based on the medications that you're taking. Now, if you are a Discount Drug Mart patient, you don't need to bring your list with you, because we already know what medications you're taking, and we can do a plan comparison for you to show you that, yes, Terry, you're in the right plan this year. Or, you know what, we should take a look at this other plan because your copay on medication A has now doubled. So that type of specificity by patient within a plan with all the medications, we can be a really valuable resource for.
There's a question that popped up here about insurance brokers and that, and I asked that question before, but another thing is, most of us have friends in our age range, ask around and say, hey, just like you say, where's a good place to eat? I like seafood or whatever. Well, when you did your Medicare thing, what about that broker? Did you like them? You didn't like them? That kind of stuff. So sometimes word of mouth is the best recommendation. A question came in here, and this is one from Kim and Jason. In fact, this would apply too to my sister-in-law. She had a kidney transplant several years ago. And boy, you're on a lot of drugs there. See, basically, what about the transplant people? She feels like it's kind of a specialized area. How can you help them?
Yeah, so I believe the rules with Medicare with transplant, if somebody is a Medicare beneficiary, so let's just say traditionally 65 and older, then the transplant medications would be a Part B, as in boy, benefit. Now, those folks that might not yet be on traditional Medicare based on their age, if their transplant was administered while they were on Medicare A, then those medications would qualify under the Medicare B, as in boy, benefit.
All right, there's a question here, and this is actually a good one. Pat mentioned she's been listening to this and said it seems like this is for a lot of people just going into Medicare the first time. They're in their 80s, and they've been on this for quite a bit. What would you say? All right, how about for the veterans out there? What do they need to know about their drug plans?
And this is the beauty of the open enrollment period. So October 15th through December 7th, regardless of your age or how many Browns interceptions that they've seen over the years, that they're able to take advantage of this period. And again, kind of evaluate the plan that they're in, understanding what their priorities are. And I would think for most, priorities would be, I want to be able to see the doctor that I've been seeing for years. I would like to visit the pharmacy that I go to for years. And obviously you want to be cognizant of what your out-of-pocket expenses are with all of the above. Whether you're new to Medicare or an existing Medicare beneficiary, this is the time frame to kind of take a look under the hood to ensure that you're in the right plan based on your priorities.
I think a mistake is made. It's almost like the same thing in sports. Well, just because we've been coaching, running this sort of offense or this defense for the last 5 years, is that really the way we need to play the game now?
Sure. You might be a playoff team, and that's an acceptable outcome for most. But you know what? If you make a few tweaks, maybe you advance to the AFC Championship. So
yeah, or basically save some money. A basic question: how do I get Part D prescription drug coverage?
So Part D is something that you're able to elect to enroll in once you have Medicare A and B. So if you go with traditional Medicare, then you would need a Medicare D plan. Now, it's not mandatory, but if you don't enroll in a Medicare D plan, there will be a monthly penalty of 1% for the rest of your life. So most of us will be on prescription medications at some point in time. So it makes sense to go ahead and enroll. Now, for those that in the very beginning of the process determine that an Advantage plan is a better fit for them, so a Medicare Advantage plan, most of those come with a Part D component as well. So you can do all that in one fell swoop. And you guys had talked about a broker earlier, and I think you hit the nail on the head related to where you choose to dine out. It's about who you trust, and sometimes a recommendation from a friend, is very valuable. I can tell you that we've partnered with Medicare USA, happens to be a national broker, and the importance there is not a plug for them, but a key component of why we've partnered with them is this is an outfit that has widely appointed brokers. So Kristen had mentioned earlier that there's 93 plans in Cuyahoga County alone. Well, if you happen to work with a broker that's only appointed to 2 or 3, guess what? you've just narrowed your scope of what plans that broker can enroll you in. So a broker that's widely appointed is something that's valuable so that you have that full scope of the 93 plans in this example to choose from.
I just got a really good question from Susan. It's something I've never thought about. And she says, I got the question right here. Should I ask the pharmacist if there's a cheaper price on the prescription if I don't use my insurance?
Yes. And that's something, look, we don't make more money necessarily if we bill a prescription to an insurance company versus not. So as pharmacists, the folks that are in our stores on a daily basis, we're there to help our patients. And in many ways, that means helping them stay adherent to their medication. So there may be times where our out-of-pocket cost would be lower than a traditional copay. But to take that question a little bit further, when we talk about coming into the pharmacy for us to help do a Medicare plan review, we can not only look at your current medication profile and say, okay, medication A, B, C, and D, if you stay in this plan, you're going to be in good shape, just as good shape as you were this year. But I'm looking, Terry, at medication A, and there's a generic that's now available.
Yeah.
It's as safe and as effective, and we could probably save you about $50 a month. Would you like me to call your doctor to see if we want to switch it to a generic? So that's another, valuable opportunity for patients to take advantage of this period, but it doesn't have to be the annual enrollment period for pharmacists to do that type of work. I mean, that's where the value of a community pharmacy versus a mail order or some entity dropping medications off at your doorstep with a drone. It's that trusted relationship that you can have with the pharmacist that's really meaningful.
I know another issue is actually the other way, like with one of the prescriptions that my wife needs to take for her allergies, is it turned out, tried the generic and it didn't work. It just didn't. So we had to go on the regular one, which is costing us, obviously a lot more than the generic.
Yeah, and that's an investment that's probably worth making for you guys. And
help
that's with
when people like that say, all right, hey, it's great the generic is, but it just isn't doing it.
Nope. And that's why it's not automatic. That's going to be a conversation that says, hey, here's a generic alternative. Do we want to discuss this with your physician? But not something that we would automatically convert you to without a conversation.
I don't know if anybody knows the answer to this one here that's up. It says, if you select a Medicare Advantage plan, then next year you want to switch to a Medigap plan, what was that not guaranteed being accepted back into Medigap? I guess all the switching around, that there is always Jason, there's a chance that you could run into some trouble. Is that what you're?
Yeah, I think Dr. Koenig and Kristen, that would have been a little more in their wheelhouse. But I do know that if you have traditional Medicare, so A plus B, without the Advantage plan, then that's where a supplement would make sense for some to fill in those gaps and cover some of the out-of-pocket expenses that would be left with just traditional Medicare. A Medicare Advantage plan, which would be A, B, and D combined in most instances, you're not able to have Medigap, and really it would be redundant or unnecessary. I think they touched on, and in your question was, well, what if I want to go from an Advantage plan back to traditional Medicare and would be interested in a supplement? Is there some type of penalty? And I don't know the answer to that question, but I bet we could follow up after the webinar.
Right. And a lot of those things too are things that we need to do. I mean, this came in from Marie, and actually we've used this at times too. Look for the GoodRx prescription prices. Any thoughts on GoodRx?
Yeah, I mean, so that's something that we accept at our pharmacy, and I think most pharmacies across the country do as well, because we want our patients to be on their medications, continue to take their medications so they remain healthy. Now, in a lot of situations when patients are on a Medicare Advantage plan or a Medicare D plan, especially on generic medications, they may have copays as low as $0. And as valuable as GoodRx can be for some, in most instances with the Medicare plans, your copay is going to be less than what GoodRx can get that out-of-pocket price down. But we would always be happy to take a look for you.
Yeah, I mean, that's the nice thing. I think when we go in to pick up the pills, is what I'm hearing from you, is like, say, is there a cheaper way of getting this? What about GoodRx? Don't just take it and pay it. In other words, ask.
Yep. And we're always on the lookout too for ways to save our patients money. But I think we all understand the idea of being our own healthcare advocates. So never would we be offended
Right.
by somebody asking, hey, is this the best option for me?
All right, last question, then we're going to bring all the panelists back. When I sign up for a Medicare prescription plan, how do I choose a plan? Or does Medicare Advantage take care of the coverage for the medications?
It depends on the situation with the Medicare Advantage plan, but that's something you want to be mindful of as you're having that conversation and making that decision, that not only in that A and B combo, which really speaks to the hospital,
Yeah,
the physicians, but also now the Medicare D, which is combined, would be part of the pharmacy benefits. So you want to be mindful not only of the pharmacies that are in that network and whether they're preferred or not, but also the formulary of medications and what those copays would be. So that's part of the entire conversation.
and before we bring everybody back, and I'm going to bring back our the whole bullpen is going to come into the game here in a moment. But I like this question came in from Don. Just said, is it cheaper to get a prescription for all 3 months as opposed to 1 month? Is there any savings there?
Sometimes there is. And
Okay.
I think Dr. Koenig had mentioned mail order as an option, and community pharmacies have the ability to accept mail order rates, which essentially means our patients can get a 90-day supply at the community pharmacy, but have the same benefit of a copay as if you were to get mail order, because we want you to come to our pharmacy. We want our pharmacists to be able to provide care for you. And we think in most situations, our patients like dealing with somebody face-to-face or a name that they can call up at any time of any day as a valuable, trusted resource. So we have made the decision to accept mail order rates, which essentially means your copays would be the same whether they were mailed to you or come to our place.
But yeah, sort of the same thing through the mail, or only there's a person you could talk to.
Absolutely.
Teresa, are you there? And Dr. Koenig. Teresa, last thoughts. Big moment here. You get to close this out with your nice sunset behind you from Lorraine.
Yes, thank you. So I think I'd like to just mention, because we haven't mentioned it up until this point, are the Medicare savings programs.
Yes.
So for individuals who have a little lower income, there are programs out there. That's where all the acronyms come in, the QMB and the SLMB and the LIS. They will help pay your Part B premiums. They will help pay your copays and deductibles. They will help pay your prescription costs. However, there are eligibility requirements in terms of income and resources. Don't want to get in the weeds about that today, but
Yeah.
if you call the Area Agency on Aging, we can help walk you through that.
And Dr. Koenig?
I just want everyone to get a plan that gives them good coverage. Even if you have health chronic conditions, your sense of wellness and well-being is important. And like Jason said, there are a lot of resources to help you, community pharmacies, your docs, but make sure you're getting coverage for what you need that fits for you.
And so, one other thing too that comes up before I ask Jason there is, I think sometimes we just need, whether we're going to the pharmacy or dealing with some of these things, we have to just ask more questions. And I could tell you this, sometimes, in fact, on the wall at Dan Gilbert's office at Quicken Loans and other business he owns, there's a big sign that says, "They are not us." I'm going to repeat that again. They are not us. So what he means is that the people working there should not assume that they are, the customers, in other words, are as knowledgeable as they are. In other words, we got to be willing as customers and consumers out there to ask the same question, maybe 3 different ways. And some of these I've tried to do that here to get clarity, because this stuff's complicated. And I will just say simply this too. You go to a broker and they mentioned too, if they only have 1 or 2 plans, they're trying to make you feel stupid. Find another broker. And the same thing too, you go to a pharmacist and they don't want to deal with you, find another pharmacist. And so but what we really want to do is let you know that I'm so glad that we have people here. I know some of the stuff was kind of basic. We could talk about Medicare and medical stuff forever.
Yes.
But I was glad that at least we got some different ideas out. And so let's really, those of you out there, look at this stuff on the Medicare thing, but make a list of questions before you go and talk to somebody. Really, don't just think we're going to have it in our brains, because I could get, all brain tied up real fast when I'm encountering the medical system. And hopefully we are able to at least untie some of the knots today with this. So I really do want to thank Dr. Koenig, Teresa Foster, Jason. Thank you all. And I also want to thank Medical Mutual for being our sponsor, along with the Point Dior and cleveland.com. Thank you so much out there for joining us today.